you seen one of these before?
Yeah.
Okay, you can play with your trucks. Put this under your shirt. It's a little bit cold.
Dr. Leanne Newhook is a pediatrician at the Janeway. Like many Janeway physicians, she's also a medical researcher. Recently, she and her team made an important discovery.
Self-harm can be anything that a person does to themselves. It could be taking medication, it could be cutting as an example. We had I think it was 3 or 4 admissions to the ward with children and teens who had ingested different medications. We thought this would be a really interesting thing to study.
So I guess what we're first going to do is go around and just give them a
Talking to some of the other pediatricians who also do that same kind of work, we noticed that there really seems to be more kids being admitted with this. So that's where the initial research idea evolved. We focused, however, on children and teens who were admitted with the ingestion of drugs.
Researchers examined thousands of admission reports. It took about 2 years to complete the work.
So we found that the rates were indeed increasing, and that in 2008, for example, there might have been 1 or 2 cases every 2 weeks versus 2013, where there were 2 cases every week. So it had increased by 2 to 3 times over just a 5-year period.
Well, I think the importance of that study is that self-harm is a red flag for a lot of major issues in terms of mental health. This is an issue that seems to be increasing here in our province, and to be able to identify that and give hard numbers to it allows us to help teenagers and young adults during a very crucial period of their lives.
About a third of the, chemicals that the teens and children had taken were things that are in the home. We need to be safe about those things, just as we do with the toddlers. We say you have to have those things, out of reach and locked up. Well then, if your family's going through a difficult time, it's important to do those things as well.
Janeway researchers have about 60 studies currently underway.
So the Janeway Pediatric Research Unit is we like to think of it as the nexus for children's health research in the province.
Sometimes there's small amounts of funding, but they go such a long ways. And this is a study that, was published.
Without the support of the Janeway Foundation, a lot of the research we do, particularly the research we do focused on the Newfoundland population, likely wouldn't occur.